I'm Aundrea Cline-Thomas, and we're continuing our in-depth conversations about how to navigate these uncertain times. The pandemic has been marked by a great sense of loss, whether it's the loss of a loved one, the loss of our good health, a job, or sense of normalcy, and no one is immune.
Everybody say I'm not okay. Everybody say I'm not okay.
Public advocate Jumaane has been talking about mental health for years, and we wanted to check in with him about how he's navigating these difficult times. Thank you so much for joining us today.
Peace and blessings, love and light.
And I oftentimes interview you within your role as the public advocate, but today I really wanted to talk about you as an individual. First of all, how are you? How are you doing right now?
I'm taking it day by day. I think people ask that question. We usually answer, good or well or fine. And I'm not sure that a lot of us are.
Do you have like a process where you're just kind of checking in with yourself about how you're feeling?
I pray at least twice or more a day. That's important to me. I try to take some time right after I wake up and right before I go to sleep to kind of just a couple minutes to myself. I use the Calm app, actually. I don't know if you've ever heard that app. It's been helpful. But honestly, one of the things I discovered, doing my therapies, just for many years, kind of just suppressing feelings of pain and other things. And I've had to oftentimes just check myself and be like, these feelings are real. You're allowed to go through them and just experience them.
I want to take you back to a particular week that really struck me. It was after the Central Park incident.
I'm going to tell them there's an African-American man threatening my life.
George Floyd had been killed, and there was a press conference, and your voice was shaking, and you said, "I am not okay." Do you remember that?
I do remember.
Yeah, take me back to like what you were feeling in that moment.
Generally, when I'm speaking, my secret is I'm usually trying to say things that I need to hear, because if I feel like if I need to hear it, I know there's a lot of people out there that need to hear it, and it may not be said. And being not okay was I needed to hear that myself. I need to hear other people saying that, so I thought other people needed to as well. I just want to make that space for us to say we're not okay. That's the first step in actually trying to get better and healing.
What is happening in your body where you're saying, I'm not okay? What do you notice that's different about yourself?
As a male and a Black male, you are taught through everything as you grow up that these are not emotions that you're supposed to allow to come out. They're not emotions you're supposed to express. And so they can manifest in very destructive ways. And you're just trying to figure out what to do. And I'm feeling upset, and I'm feeling sad, I'm feeling angry, I'm not feeling like myself. And usually before those times, it's like I don't know if spaced out is the word, but I'm not fully here.
What has therapy taught you about yourself?
There's a lot of things that we carry through childhood and growing up, and sometimes we excuse it, sometimes but it does stay with you. And so I often think about the little kid who was in pain and kind of trying to figure out how to navigate his way through life. And I think about him a lot, and just make sure that you remember that person is still there.
I've like doubled up my sessions now during this time, just because it's just been like, I need to talk through some things, but people still feel like in our communities and Black and brown communities specifically, it might be a little too woo-woo, or I could just pray it away, or, living with hardships for so long, it's just like, this is how it is.
There's a thing called false consciousness that can happen individually or as a community. When things are happening, even if they're bad for so long, you begin to accept it as just the way it is. But of course, it manifests itself in destructive ways, either internally or externally.
What would you tell somebody who knows that they're not feeling like themselves, they're in the state of overwhelm, and they don't feel like they have the resources or that there's any other options for them?
That's not an abnormal feeling. That's a human feeling. Nothing is going on that shouldn't be, particularly based on all the things that are going on here. And if you can find a moment of strength, because it is strength to reach out and ask for help. It is strength to reach out and say, I'm having some trouble right now. Just ask someone for help. Just, call the hotlines, call someone, tell a friend. It's amazing. Just that one part, just doing that, can release so much and begin the process of healing, or begin the process of being able to cope.
Absolutely. Thank you so much for
Thank you.
joining us. I really appreciate it.
Thank you.
To talk more now about mental health and how to cope is Dr. Mark Epstein. Dr. Epstein is a psychiatrist in New York City and the author of a number of books about the interface of psychotherapy and Buddhism. Thank you so much for joining us.
Yeah, pleasure to be here.
When should somebody seek therapy?
Where two people sit in a room or on a computer together, on the phone together, with no agenda other than talking about their feelings, other than talking about what they're struggling with in their minds. It's such a gift. It really is you don't have to be suffering terribly to seek therapy. Therapy is like having a friend who you can confide in and maybe once in a while get some decent advice from.
What are some of the common concerns your patients are having right now?
The uncertainty, I would say, is the key word. And behind uncertainty, anxiety and depression.
What does that mean?
The mind is just, repeating anxious thoughts, repetitive thoughts. What's wrong? What's going to happen? I don't know what to do. So that's the anxious side. The depressed side is, oh, I just can't get going. I don't have an appetite. I don't know what to do with myself. I don't want to get out of bed. I just want to hide. The people in my life who I am supposed to care about, who I do care about, I don't really care about. No one really understands what's happening with me. And a kind of loneliness. I would say loneliness would be the other aspect of things that could be on the anxious side or the depressed side. The signs of a real clinical depression that medicine will help usually are everything physical slows down. Their thinking, they can't quite concentrate. That's the other big sign of it. They might be having thoughts, suicidal thoughts of hurting themselves. Though that constellation of symptoms is indicative of a depression where people should seek help. And the medicines are very helpful for that. When they work, they really work.
And how are you helping them cope?
I try to help people with whatever I feel will help them, either the medicine or the talking or the meditation. I would say those are the three areas that I draw from.
Talk about meditation. I've tried it.
Yeah.
And I feel like I can't get my mind to quiet.
No, you can't. Nobody can.
Okay,
it's not really.
I'm just I'm not doing this right.
Yeah, no, everyone thinks, oh, I can't do it right. I'm not doing it right. There's no doing it wrong. That's the real thing. When I'm teaching meditation, I usually start people not with the breathing, but just with listening. So I'll have somebody just sit in a comfortable way and bring your attention to whatever is surrounding you in the way of sound. So it could be the delivery people or the traffic or the TV or the dog, or it could be relative bits of silence. But we're not going to push away the unpleasant sounds, and we're not going to hold on to the pleasant ones. We're just going to let sound unfold as it wants to. So it's taking that attempt to control things that is really at the root of a lot of our anxiety, because so much of what's happening we can't control, So when we sit in meditation, it's actually about giving up control.
We have a viewer on Twitter who asks, how do you deal with feeling overwhelmed?
So the feeling overwhelmed, while it's a true feeling, it's still only a feeling. And when we learn how to allow that feeling, to leave it alone rather than to be gripped by it, then the feeling tends to take care of itself. And then a moment might come where you're not feeling overwhelmed, and that's such a relief.
What are some concrete steps they can take right now to lead them towards just a healthier mental journey?
Well, the first thing that I think is really helpful is to make a schedule for oneself. It's very important to make a little bit of time just for yourself, you know, whatever situation you're in. So that might mean getting outside first thing in the morning, like we talked about, or it might mean setting up a place with, you know, some cushions or a comfortable chair. And before you get on the computer, before you turn on the TV, before you listen to the radio, just to take those 5 minutes, 10 minutes of sitting and listening to the sounds, listening to your body, being with your mind. You really matter, each and every one of you. And that light is inside of all of you, and it needs to be nurtured. If there are people who are listening to this, you know, who are hearing me talk about meditation and so on, meditation's not a panacea. It won't cure a deep depression. But there are treatments, there are medicines, there are professionals, there is help available, and people should not hesitate to reach out for help.
Yeah. Well, fantastic. Thank you so much for joining us. We
You're
really
welcome.
appreciate it.
Okay. All right. Thanks so much.
Thank you. No matter what you're going through, it's important to remember that you are not alone. There are ways to get low cost or free help in New York, New Jersey, and Connecticut. We'll post a link to all of the resources on our website, cbsnewyork.com.